Hello, I'm Lynne Meadows, the Director of District Health Services for Fulton County Schools. In this 3-episode podcast series, we will speak with healthcare providers, parents, and school nurses about the ASIST study and how the results impact students with mild asthma and implications for improving health equity. This podcast is supported by grant number EADI 26916, funded by the Patient-Centered Outcomes Research Institute, or PCORI. This is the second episode, and today we will be talking to the parent of a student with mild asthma. Just to be clear, the ASIST study stands for, or is an acronym for, Adjustment of Inhaled Steroid Therapy Study. Our guests today are Tanisha Sanders and her son, Rylen. Ms. Sanders is a parent of a student in Fulton County School System, which is located in Atlanta, Georgia. Her son, Rylen, is a 4th grade student at one of our elementary schools. Welcome, Ms. Sanders, and thank you for joining me today. So I would like to begin with asking you to tell us just a little bit about Rylen, how old he is, when he was diagnosed with asthma, and anything else you would like for us to know about Rylen.
He's 10 years old. He was diagnosed with asthma maybe around the age of 5. I can't remember the exact diagnosis, but he's had off and on episodes with asthma. So we've been kind of, in and out of like hospitals and stuff like that, just trying to, be more knowledgeable about his asthma. But other than that, he's a regular functioning kid. He does use his inhaler when it's needed. He's very active. He loves to play soccer. Just all around bright kid.
And I've had the opportunity to meet Rylen, and he is just that. He is a bundle of joy. So tell me a little bit about, would you describe Rylen's asthma as mild, moderate, or severe?
At first, I would say it was more so mild, but it's in between mild and moderate. I guess in between the flare-ups, because lately he has had more flare-ups than usual. And I don't know if it's due to just like the weather or just his activity, but lately, or more than normal, he's constantly having issues with like breathing. So he's not having issues, but just maintaining his asthma a lot more than he was before, if that makes sense.
So does Rylen have a regular pediatrician or healthcare provider that he sees?
Yes, and she recently just changed his asthma chart. So instead of him taking that medicine, the Flovent, as needed, if I'm understanding this correctly, because I got to give them a call today, he needs to take that every day in order for the medicine to, get in his system and work in his system. And then he has one that if he does do physical activity, that he needs to take. So he has 2 at this time.
Gotcha. So he takes his Flovent, if you will, once a day, and then he has his inhaled steroid or his inhaler that he carries on his person and or has at school. Is that correct?
Yeah, that's what it is. And I think the school nurse at High Point has his that inhaler.
Understood. So a little bit more about your healthcare provider in the sense of treatment and caring for Rylen. Have you noticed any barriers, or are there barriers that you can share with us? And again, this is a great learning opportunity for the school nurses who are going to be listening to this podcast. And healthcare providers, are there barriers that you've experienced?
I would say the only barrier is changing of the pediatrician that he goes to. They have changed doctors. So I guess with them getting to know Rylen and his chart and his, asthma history, that's been the only barrier, because I feel like we've gotten different reviews about his asthma, and I know she mentioned that she wanted him to go see like a specialist if he does have like another episode, and that was from one doctor. So that was the only barrier of me. Just, I feel like I need to just do more research as far as like pediatricians who kind of like care for kids with asthma.
And that is such a great point. But it's good that you have the resources and the means to be able to find a good pediatrician and a healthcare provider and that your healthcare provider that you have are making sure that you're connected with other specialists that may be needed. So speaking of Rylan's care and going just a little bit deeper, other than the making sure you're connected with the right healthcare provider, are there any other concerns? Do you worry about, and you talked a little bit about the school nurse, his asthma being managed while he's at school?
No, I don't worry because this year, or if he's had an episode recently, I've been notified like in a timely manner. Before, I don't think I have been. Well, no, I don't think I really had any issues with the school nurses. I mean, I've always been kind of like notified and things like that. So I feel more secure in that way. I feel more secure when he's at school, in any other place because I know, that he'll definitely get the attentive care there.
Well, as a school nurse leader, that's good news to hear. I'm glad. So, again, and this might be a question that you might have to think about just for a minute or so. So, speaking of, his asthma being managed at school and then, of course, at home, how would you, as a parent, measure success thinking about Rylan's asthma management? What do you foresee is I feel confident and good, in terms of because XYZ might be happening with my child's management of his asthma?
Rylan, he's very like independent and he's he really takes on pretty much, his asthma. He's very aware of like if something is happening that he needs to notify me or a teacher or anything like that. I would gauge it as far as like just making sure that he is knowledgeable about like his asthma. Some things he tells me and I'm like, oh, I didn't know that, but thank you for sharing. I do need to know. I need to be, as his parent. But I'm just glad that he's more, I guess, engaged into his asthma and how it works. And if he's feeling something, let me know so that I can get him that help. And then also just being able to really contact our pediatrician because, regardless, I know we've seen different doctors, but they are always open and ready to like see him if he's having an episode. And that's big because at one point I didn't feel like I was able to, get that when he was younger. So it's gotten better, I would say.
Right. So having that ease of accessibility to a provider when you feel like you need some further or Rylan needs some further care or you have questions, just having that ease of access to be able to access your provider, it sounds like a measure of success for you.
Yes.
And I love the fact that you mentioned how responsible and engaged Rylan is in the management of his care, even at 10 years old. And I just happen to know Rylan is actually engaged in one of our programs where he utilizes a little bit of time doing his specials at school to participate in an asthma education program. So it sounds like that's been beneficial as well.
Oh, I didn't even, he didn't even tell me that. I didn't even know.
Yes. So that's
See?
awesome.
Well, that's good. I'm proud of him. I'm gonna have to tell him, let him know.
Well, it's good that you have seen that at home because I wrote down the fact that you said he's confident and can tell you things about his
Oh
asthma
yeah, that's where it's
and
coming
speak on
from.
his own behalf.
Yeah, that's good. I'm happy. I'm happy.
Great. So, thinking about Ryland's asthma care, and if there is any challenges, and clearly you've said some of the challenges that you think you've had in the past have been resolved, and we just talked about, for instance, the accessibility to your healthcare provider. But are there anything else in terms of maybe not a challenge, but that may have been difficult or a barrier that we can think about either as school nurses again or healthcare providers to assist, parents who do have children with mild asthma? Like, is it education that you just talked about, reminding them about their inhaler or running out of medication? And you talked about one was, of course, getting to your healthcare provider, having the ability to adjust the inhaler dose or communicating with your school nurse. So you talked about in the past that you resolved some of those things. Anything else that you can think of and if you think of it as a barrier, what we can do maybe to remove that as a barrier?
The only barrier that I can only think of that's not so of a barrier, but something that I'm working on is just, I guess, the consistency of just remembering, like, this is medication to take daily. But I mean, he helps me with remember, like, we kind of like bounce off of each other. So, and then with the program, and then like I'm getting different stuff sent home. So I don't know. Like I say, I can't think of any barriers like at this time. I will say that the special, getting into a specialist, trying to like make an appointment, getting one, that has been like a barrier because like they have a lot of their calendars and stuff are like booked up months and months
Mm-hmm.
out. So that, yeah, that has been a barrier as far as getting to see a specialist as soon as possible. But other than that, I can't think of any, I guess, like major heart stop barriers right now. I don't know.
Gotcha. Okay. And that's good for us to know as we think about, and from a school nurse perspective, how we might be able to help our parents connect with specialists. And like you said, sometimes it's a matter of just timing of appointments, et cetera,
Hmm.
but how we might maybe help with that connection through a specialist and looking at what that time frame might be and if there's anything that we can do to assist with that. So that's a very, very good
Oh
point. So
yeah. No
so I'm going
problem.
to switch gears a little bit and talk about the ASSIST study. And so, you're very familiar with the ASSIST study, and thank you for participating in the fall in the focus group that we had when we talked about the research. And of course, the research shows that students with mild asthma using the inhaled corticosteroid only when symptoms are present is as effective as daily preventive use, which is the current standard. So it sounds like, and you talked a little bit about it, that you've changed the way that Rylen is utilizing his inhaler, meaning that you've spoken to a healthcare provider, or when you had your last visit, you now are using, or Rylen is using his inhaler on an only as needed basis during the day. Is that still the case, or share a little bit about how you're managing now Ryland's care in light of the information that you gained from the study?
Managing it as far as like making sure I keep up with all of the paperwork that comes from the doctor's office. That is important, like the new charts, and also just making sure that we have all of his medication. Even if like I mean, I know we're out of it now, but that's because he's been continuously using it. But just making sure that I am, close to the pharmacy, I have access to that. That helps. I've kind of like, just started utilizing my resources that I have.
So, have you noticed a difference? And I know right now you said that currently Rylan is a little bit under the weather, but prior to him being under the weather, having the ability for him to use his inhaler just on an as need basis was a better management for you than it being on just such a prescribed every, certain amount of time, hypothetically, like every 4 hours, instead of him having to use it
Yes.
on a routine basis versus when he needs it. Have you seen or noticed a change with that? Has that been more positive for you and positive for Ryan?
Yeah, I mean, it has been more positive for Rylan because, he hasn't had, like, I've seen a change, like a difference in his breathing and things like that, especially when he comes to after school because he does karate as well. So I've seen a difference. The change was the consistency, like coming from an as needed basis to like an everyday and every 4 hour. That was a transition. So, I mean, it's a positive transition, but it was a transition for me as well. Like I said, the consistency of it, but it's going well. It's going well, and we're gradually, just getting in the flow of that.
Awesome. Awesome. And so it sounds like also, since you're getting in the flow of that, your provider was supportive of the change of Rylan just using it on an ad needs basis instead of a prescribed basis.
And then a few times, when he went for, they did prescribe him twice a liquid steroid, but that wasn't as favorable. She didn't
Hmm.
want him to be on liquid steroids anymore, but it did the job. It got him cleared up. So I do appreciate the time because he was feeling really, really bad. But with that medicine, and I know it's not favorable, it made him feel better.
So it sounds like as well, just being a parent and you being the parent of an asthma student, really a child's asthma care, as they grow and as things change. And like we talked about, the seasons change. Even now we're getting ready to move into the pollen area. Having having a healthcare provider that can make those changes with the parent and with the student or with your child is also a great benefit of having a healthcare provider, obviously, that's very in tune with children who have asthma.
Yes, very much
So the
so.
care can be managed and tweaked as needed based on seasons, based on the presentation of the child, the whole 9 yards. So that's really a strength then that you have.
Yes, yeah, because asthma, his asthma has changed seasons, and we have gone through a hurricane and come back down to just a rainstorm. So, yeah.
Right. Okay, well, that is great. Well, I know we had wished to talk to or hoped to talk to Rylen today, but since he's not feeling well,
I can wake him up. He doesn't mind. He wouldn't mind speaking. Let me. I can go get him really quick. Give me just a second. He's here.
hi,
Hello.
Rylen.
Hey,
How are you?
good.
This is Nurse Lynne. You may remember me. I'm one of Nurse Paulette's good friends. We had the opportunity to chat last fall when you participated in a session like this. Do you remember?
Yeah.
Well, your mom shared with me that you might not be feeling your best today, but do you feel up enough to answer just a few questions?
Sure.
Well, I appreciate you being such a good sport. So, and this won't take long at all. I just have a few questions, okay?
Okay.
All right. So, my first question, and again, I want to welcome you and thank you so much for, like your mom, taking the time to chat with me a little bit about your asthma. And so, I just want to ask you, Rylen, in thinking about your asthma, when you're at school, do you have any concerns about your asthma? Do you feel comfortable when you're at school? And who
Yeah.
helps you to manage your asthma while you're at school?
My teacher
Your
and the
teacher helps
nurse.
you and the nurse. Okay. And when you feel like you need to use your inhaler at school, are you able to just freely let your teacher know you need to go to the clinic? Or tell me a little bit about how that happens for you.
Yeah. She would just let me go to the clinic anytime.
Okay, very good. So your mom was telling me how smart you are with your asthma and how you've been able to share with her some of the things that you've learned about your asthma, and that when you feel like you need to use your inhaler, you know that right away and you can ask, like you just said, your teacher to be able to go to the clinic. Is that right?
Yes.
And then when you're in the clinic with the school nurse, and I know that you work very closely with Nurse Abby, how does that work for you? When you get in the clinic, are you able to take and use your own inhaler by yourself?
Yeah.
Well, awesome. So I know that now, unlike before, when you need to use your inhaler, you can just let your mom, if you're at home, obviously, or if you're at school, let the school nurse know that you need your inhaler. By now, you don't have to go to the clinic, say every 4 hours to use your inhaler. You go only when you need to use it. Has that been better for you and easier for you to do that way?
Yes, it has.
It has. Well, that's great news because I know that you are very busy. Your mom was telling me about karate. And I think the last time we spoke in the fall, in addition to being in school all day, you also were doing, I think, soccer. So just having that ability, even when you're, to utilize your inhaler when you are engaged in your activities and no longer having to wait to say a certain time, has that helped as well?
Yes.
Very good. So what else, Rylan, would you like for school nurses who may be listening to what you're sharing with us, and even doctors and healthcare providers? What would you like for us to know about treating our students or our children with asthma?
Um, ways to control your asthma.
Okay, very good. And how can we help you with that?
I don't really know.
Ways that you can think of that we can do more, like school nurses or your doctor? Can't think of anything?
Yeah.
Okay. Well, that's okay. Well, I'm hoping that you can't think of anything because your healthcare provider and your school nurse is doing such a good job at helping you to manage your asthma. And
Yeah.
your mom.
Mm-hmm.
Well, very good. Well, thank you for being such a great guest. And despite not feeling well, you taking the time to answer and share with us your perspective about your asthma. And Ms. Sanders as well, thank you as well for taking the time out from a parent's perspective and sharing with us your experience in managing your child's asthma. And so as we wrap up, is there anything that either of you would like to share or leave our audience with?
I don't really think there is.
All right. Well, what about you, Miss Sanders?
I would just say, thank you all for everything that you do. School nurses really has been very, helpful for me and Rylen. If it wasn't for our school nurses and the support of the teachers and just the facility and staff, everyone, I probably would be lost. But I do appreciate the support. So that's my take on it. Yes. That's it.
So, again, thank you so much for taking the time to speak with us. So, as I wrap up and conclude this podcast, I believe the takeaway for school nurses is considering the results of the ASIST study. Having the knowledge of this evidence based option for asthma management can be used to promote equitable student centered care. And I will add, as Ms. Sanders and Rylen said, just being able to support and be educated about this study makes a difference as school nurses as we manage students with mild asthma. And finally, just to reiterate, the research adds to evidence that, again, symptom-based adjustment of medication, meaning inhaled steroid, works as well as provider-based adjustment for treating children and teens with mild persistent asthma. And again, finally, based on the research, using an inhaler only when symptoms are present or when needed is as effective as daily preventive use. This information is provided in a new evidence implementation guidance document developed by the National Association of School Nurses. School nurses, you can find the NASN, or the National Association of School Nurses, PCORI, ASIST Study School Nurse Implementation Guidance at NASN's website, which is NASN, NASN.org, under Resources, Fact Sheets, and Infographics. It is entitled Evidence Implementation Guidance, the ASIST Study Results for Mild Asthma, Fact Sheets, Education Briefs, and Infographics. Again, and that can be found on the National Association of School Nurses website at NASN, NASN.org. Again, thank you so much, Mrs. Sanders and Rylen, for participating in this podcast. As we heard during this conversation, school nurses play a critical role in helping to care for and manage students with asthma. School nurses' expertise and knowledge about asthma and potential resources, like accessing healthcare providers and specialists, can certainly have a great impact on students and families, and in addressing health equity. School nurses have the opportunity to engage students when they visit our clinics, and by utilizing our knowledge and skills, we have the opportunity to consistently provide and reinforce asthma education and help our students and families understand asthma management and treatment options. Thank you all for listening.